This video may seem to be a little simplistic, but we're going to discuss some things that can make your brushing more effective and in the long run help you do a better job. Now, first of all, we all know that hard toothbrushes cause recession, but fortunately most any toothpaste that you find in a drugstore now is a soft bristle brush. Also, there are many mechanical or electrical toothbrushes out there, and to my knowledge they all have soft bristles on them. They have different strokes, some rotary, some vertical, and so forth, and quite frankly I don't think the difference in the type of stroke makes that much difference as long as you're using a soft bristle brush. Now, the first mistake that I think people make, and this is perpetrated by advertisements on television, for what they do on television, they recommend that you cover the bristles on the brush. Look here, how much? Cover the whole amount there. That is way too much toothpaste, because if you start brushing with that, not only do you gum up the mouth, but you have to purse the lips like this to hold all those suds in there, and that really prevents you from getting behind, say, the second molar back here. Now, one of the things that people in the families have a problem with is who is going to put the top on the toothpaste, and this is all a confrontation. Well, let me tell you what, in my opinion, everybody ought to have their own toothpaste, because the easiest way to get the proper amount of toothpaste, notice that I squeeze this, and notice how little toothpaste is on my tongue compared with what I showed you earlier. So therefore, take a dry toothbrush, and notice how that I have no problem lifting my lip using sort of a rotary motion right at the gum line. But notice how I can relax the cheek. The teeth should be almost together, and looky here, I can get behind that second molar. Behind the second molar, on the lingual. Now, as I'm brushing, I'm stimulating the mouth, and I'm getting saliva flowing, and I'm getting a fair amount of fluid in my mouth. Now, I go down on the lower. And notice that I don't have to purse my lip to hold it in, but one of the things that's happening right now is I'm getting a fair amount of saliva. Go ahead and spit that out. We've made one turn. Now let's make another. See, I can even talk to you, and we're rotating that in sort of an oval fashion right at the gum line. And we're doing the same thing on the lower. Now you'll notice that what I used on that was a gel. And I think that's the next mistake, because even toothpaste per se is a milling gel, and there have been studies out there that have shown using a mechanical arm to brush a tooth over and over and over and over and over and over and over a period of time, that you can get removal of tooth structure after there was recession by using a toothpaste. So therefore, I think you ought to use a tooth gel. So the first two things you've learned is, number one, don't use too much toothpaste and use a gel rather than a paste. And the other thing you've learned is everybody should have their own tube of toothpaste, which they can use and actually go ahead and put their mouth on it. And if they want to screw the top on it, fine. If they don't, fine. But everybody should have his own one. Now, let me show you something else. Here is a sample of toothpaste that we used to give in the clinic, and I used this for a while. But notice how this is completely used up. Now, if you're using your own tube of toothpaste, after it's actually used up, you can go in there and suck on that and you can get a little dollop of paste on there. And therefore, I find that when a tube of toothpaste or tooth gel, as I've told you, is gone, I can probably get 2 or 3, not 2 or 3 weeks, but I can get a week or 2 of extra toothpaste out of there, so it makes it even a little cost effective, although that's not a very big point. Now, we're going to talk about, and there's a video on that, about the importance of cleaning your tongue and why you should clean your tongue. But the biggest reason to clean your tongue is that 90% of the bacteria left in the mouth after you have brushed and flossed are left on the posterior 1/3 of the tongue. And if you try to get back there with a toothbrush, you can't get that far back without gagging, and all you can do with a wet toothbrush is go in there and smear the bacteria around. Now, you need to have a metal scraper on that, and this scraper is the one that I like. On the website, you can find this is made by Dr. Robert Rippich. It's called a tongue sweeper, but it's really a tongue scraper. And unfortunately, I did not find out about this till I was 70 years old. I just wish to hell I'd found it a whole lot later. But notice how far I can put that back. I want to scrape and get that off. And people that have used this have said that if they've gone out of town and they've left it at home, they can't wait to get home because your mouth feels so much cleaner back there. Now, it's not going to be on this video, but it's on another video, the importance, I think, of using a very weak solution of sodium hypochlorite after you have brushed and flossed, and use that before you scrape your tongue, scraping that solution into the tongue, disinfecting the tongue even better, and I think this is the best way of preventing malodor, halitosis, or whatever you want to call it. The next thing that we want to talk about, we're going to talk about the difference in flossing the healthy mouth versus the unhealthy mouth. And the first thing you want to do, the biggest mistake in flossing, is not getting a big enough piece of floss. Notice that's about 18 inches long. So if you get a little piece about like this, there's no way to wrap the fingers around it and get the job done. So what you want to do is wrap the floss around the middle fingers. And the working area, as we see here, is only about 1 inch or 2. Now, in flossing the unhealthy mouth, the gums tend to bleed, they're tender and all like that, and the first thing you don't want to do is to pop the contact. Because when you pop the contact, you impinge on that sore gum and it hurts. Now, there's several reasons over the years that patients give me reasons for not floss. Certainly a lot of them are lazy and just won't do it, but they'll admit to that. But the things they say that why they don't floss is, my hands are too big for my mouth. This is why. They don't wind down enough. They can't get it in the mouth. But if you wind down close enough, it's very easy to get in the mouth. Number 2, it hurts, and that's because they pop the contact. And number 1 and number 2, whatever it is, another reason is it makes my gums bleed. Well, if it makes the gums bleed, that means you need to floss more, but you don't want to hurt yourself in doing it. So let's talk about flossing the unhealthy mouth. Now, rather than coming vertically like that, you want to come down and floss the contact toward the lingua. Now, once you have done that, notice we're flossing at this angle, not vertical on that. So as we floss through, we haven't popped the contact. Now take this finger, and here's the other important thing. You only use 1 finger for flossing, not 2. So we worked it through, and notice that this finger is a flossing finger, the other finger is dead weight. And what we do, Notice how I shine that tooth. Then we come back here and we floss like that. In other words, you want to wrap the floss around the tooth, letting it go slightly beneath the gum to where the plaque needs to be removed. For instance, let's do that on an upper tooth. We go through there and notice how, or we do it the buccal finger is the flossing finger. The one on the lingual is the dead weight. So notice how I'm doing that. And the thumb there. And then gently pull it through like that. So that's a way that you want to floss an unhealthy mouth. Now, I've got a healthy mouth. My gums don't bleed. And so therefore I can make it much simpler. So what I do, I have no problem with popping the contact. But be sure you get behind between the 6-year molar and the 12-year molar. And notice I just pop it out. So doing that, now here's a little hint that I do on the lower teeth. Notice I floss and I use the lip to kind of push it up. Now that's the difference between brushing, flossing in a healthy mouth and an unhealthy mouth. And remember, you're only using one finger to do the action. And when you're flossing, it's always the buccal finger that is actually pulling the floss, and the other tongue side is the one holding the floss in. So using those techniques, I think, will help. And please go to the video on the importance of cleaning your tongue and the use of the simplest, most effective mouthwash, which is sodium hypochlorite, which initially you think that's found in household bleach. I'm not going to put that in my mouth. But if you'll use it in the portions that I'm suggesting, you will find it to be highly effective. So enjoy this, and thank you so much for allowing me to teach you how to brush and floss.